Heparin is a very widely used medications in hospitalized patients. It is mainly used for thromboembolism prophylaxis and IV line flushes, heparin-coated catheters. But whenever we are using heparin, there is something called as heparin induced thrombocytopenia. We call HIT. So HIT should hit your mind, especially in females, elderly and surgical patients. So what is the mechanism of heparin induced thrombocytopenia? As we all know, platelets will express PF4, and when we give heparin and PF4 will form a complex that will trigger the release of antibodies like IgG, which will go and bind to the complex, and normally it will be cleared off by this immune system. But in case if immune mismatch occurs, this IgG antibody, that Fc portion of the antibody will start activating the platelets. Then platelets will start releasing microparticles. Those will lead to thrombosis formation, in which platelets will be consumed. So the individual can develop limb ischemia, deep vein thrombosis, pulmonary embolism, skin necrosis like thing. So we have to keep a watch when we are giving heparin. Coming to the assessment, we can see low platelets in CBC, and there is something called as anti-PF4 antibody ELISA. And the third one is serotonin release assay, also known as platelet activation assay, which is considered as gold standard for diagnosing HIT. So mainly we have to discontinue all forms of heparin to avoid heparin-induced thrombocytopenia. And finally, do read about the topics related to HIT, 4T score, what alternate anticoagulants can be used, and the closest differentials for HIT. Thank you.